Let's get straight into it and just begin from your end, the ZMPHI, and having to, on a daily basis, report on the COVID-19 statistics alongside the Ministry of Health and looking at some of the confirmed cases that have gradually decreased. But now we're focusing our attention on what's happening within the schools. With the 140 cases recorded from DK Technical School, what is the severity of this?
Thank you very much. So at DK, we have now tested over 1,000 learners, about 1,200. And out of these, we had 153 that tested positive by yesterday. And this shows us that the positivity is over 9%. Fortunately, none of the children or the learners have been severely ill. Some have had mild symptoms and have generally been treated around the school. So this is a development which requires our attention, and it indicates to us that transmission is still occurring, and we have been seeing this particularly in closed environments. We do have a school surveillance system, and this enables us to pick up some of these cases.
And obviously, the next thing is contact tracing. Is this something that you're doing now? Are you following up on possible places that these pupils might have been? I'm sure most of them could have gone home. What are we looking at here in terms of, from your end, contact tracing?
Yes, thank you. So contact tracing has been done. A number of response measures have already been instituted. The positive learners have been quarantined, and Lusaka District, the District Health Office, is providing care and also health promotion to the school community. Contact tracing has been done. The vast majority of the learners, if not all, are boarders. But however, we've been trying to look at possible routes of transmission through which the COVID could have entered the school premises. And we have established some contacts and been able to conduct some contact tracing activities.
Okay, sorry, Justin, I do have a question for Ms. Kapina. The discussion internationally has been mostly about the types of strains that we are now seeing that are arising. Is there any way, or has ZMPHI actually isolated which strain that we may be dealing with within the school? Because if I do remember correctly, it was Delta that actually had the worst effect on people when it came to COVID-19. So do we know if it's Omicron, Delta, or is it Alpha? Is there any information on that?
Thank you very much. So yes, indeed, what we call genomic sequencing, or identifying the variants, is a part of our surveillance system in Zambia. And for COVID, we have been conducting this and have been able to identify which variants we've had across the different waves. So for the fourth wave, which I guess now is at the telltale end, or it ended, we have had mainly Omicron. And we have collected specimens from the learners at DK. We've collected a significant number, actually, but unfortunately, right now we haven't received the results yet. So the sequencing is still in process, and the results should be shared with the public when we do receive them. But yes, indeed, you are right. We could be dealing with another variant here, although it could possibly be just a different of the Omicron itself. I'm sure you've heard of the BA2 that has been also quite transmissible across the world and reported from other parts of the world. But we're still to get the actual results that will tell us what strain we're dealing with here.
We're working alongside the Ministry of Health. I mean, you're working hand in hand. But with the issue within the school, obviously it's very critical and it requires immediate attention. What does this overall mean for the school itself? Is it going to undergo a indefinite lockdown? Are we going to see school activity still being ongoing within school premises?
Okay, so what we've done with DK, which is a boarding school, we have confined the learners to the school. So that's one way of controlling the infection, by preventing it from spreading outside the school premises. So within the school as well, those that have tested positive have been quarantined away from the other learners. And as I indicated, we've tested everybody. Our screening is ongoing. So we are containing the infection within the school, and what we're preventing is interaction with the outside world, just to prevent the spread from out of the school premises.
Well, but speaking still on that, obviously you're isolating the children is one of the precautions that you're taking. But have you had any possible contact with the parents, guardians of the children, seeing that you have reported on this together with the Ministry of Health? Is there any information that has been given to the parents and guardians?
Yes, indeed. Parents and guardians have been notified that there is an outbreak at the school. And unfortunately, well, we did inform also the parents of the children that were affected. And unfortunately, at the initial beginning of the outbreak, we had some parents who insisted on taking their children. But we did emphasize that that is not, that poses the risk of increasing this transmission outside the school premises. The containment strategy here is to keep the learners confined because of the nature of the school itself. So we keep the learners confined, and we control the transmission within the school as opposed to allowing the learners to go outside the school premises.
Were you successful in convincing the parents and guardians in keeping the children at the school? Because as we know, confining the learners at the school is one thing, but then confining adults within their homes may be quite difficult. Because do you know if any of the parents have been infected with COVID-19 at this point?
We are in contact with the families, and at the moment, I think we haven't learned of any that have become infected, and that perhaps took their children home and became infected subsequently.